Now we're going to hear through a film, I think, is that correct? Now we've got a film which is, it's about a health justice partnership between Inner Melbourne Community Legal and the Women's, and it's an initiative that both parties are proud of, and Linda Gorky, Giocchi, is going to share with us a film clip.
Yes,
say a few words. So come on in, Linda, welcome, thank you.
Thanks, everyone. And the film is hot off the press. We got it from the editors this morning, so I'm looking forward to showing it to you.
It's the first release.
It is the first release. This is the premiere. I just wanted to make a few comments before we show the film. So firstly, I'm just really heartened to hear about all the health justice partnerships that are popping up at hospitals across the state. It's really great to hear from a number of different hospitals this morning who are conducting health justice partnerships. I'm a lawyer at Inner Melbourne Community Legal, and I also manage our partnerships with 3 hospitals, and there are representatives from all 3 here today, which is great. So the Royal Women's, the Royal Children's and Royal Melbourne Hospital. But this film focuses on our work at the Women's, which is our the partnerships that's been going for the longest. And I'm going to, there is a slideshow. I did want to just talk to 1 or 2 slides. Yeah, I just wanted to mention this slide before we show the film. So a lot of the work, for those of you who do health justice partnerships, know this research already, but a lot of the work that we're doing around health justice partnerships is based on this, thank you, this survey, which is called the Law Survey. And it's particularly relevant for women who are experiencing family violence. It shows that legal problems cause physical ill health in 19% of cases and stress-related illness in 20% of cases, that disadvantaged individuals are particularly vulnerable to legal problems, and that definition of disadvantaged individuals in the Law Survey also refers to women experiencing violence, and that they're vulnerable to substantial and multiple legal problems. Relevantly, for having a legal service embedded into the health service, we know that people really only turn to legal advisors in about 16% of cases for legal issues, whereas they turn to health and welfare professionals in almost 30% of cases. And when you couple that with what we know about people often disclosing family violence to frontline health professionals, it really shows that a legal service being embedded into a healthcare setting has the capacity to really respond at a critical point for women who are experiencing violence. So on that note, I think I'll show the film now.
I was expecting my first child, and that's why I was attending antenatal appointments at the Royal Women's Hospital. Because of my past history, I was seeing a social worker at the Royal Women's, and she said that there is a lawyer here if you want to see a lawyer, because I was in a very violently abusive marriage and was still dealing with depression, anxiety, PTSD. I would not have seen a lawyer if there was not one at the hospital. Financially, I wouldn't have been able to afford a lawyer, and just the stress of going to more appointments while I was pregnant, I would not have seen a lawyer.
We know that healthcare professionals are often the first person that a woman discloses about family violence to. That in itself is the reason for us to do this. We are keen to understand and help our staff to be better prepared to address this issue.
As people would expect when they come to hospital, there's a doctor, there's nursing, there's physios if you need one, there's social workers. Now we're very lucky and in a position to regularly have a lawyer as part of our team.
My pregnancy would have been a real stress and struggle if I hadn't seen you, if I hadn't seen a lawyer. Like, it just would have been so stressful.
Women who are chronically abused, we know that they're often not allowed to leave the house. However, in many cases they will be allowed to leave the house for antenatal appointments when they're pregnant. So by having a legal service embedded into the Women's Hospital, where a lot of women attend for their antenatal appointments, it provides women with an opportunity to access information about their rights and entitlements in a safe place.
It enables you, in whatever your particular role is, to do your bit. It spreads the load. It makes proper use of all the expertise that's there.
We can provide them legal advice on some quite challenging and difficult issues. but do that in a setting where there are other services around them, such as social workers and caseworkers and other supports, to ensure that people are getting all the support and service they need.
She spoke to me in terms that I could understand. She was very supportive. She just did everything.
They provide an insight and a perspective that we wouldn't have known before, and vice versa. So to them, as a lawyer, they now understand the health side of things as well. And I think that that's the key to the partnership for this. I think the biggest advice is absolutely do it. There's no question that this is integral. It should be part of the healthcare system. I would advise anyone to absolutely take this step and work in partnership with their local legal firms.
Thanks, everyone. I just want to outline, I'll just go to the next slide. As part of this project as well, we provide training to staff, and these are the numbers of staff that we've trained over the course of the project, which is since 2012. So we've provided formal multidisciplinary training to over 350 staff at the Women's Now, including 65 doctors, and that's again it's part of the partnership. So as the legal service and the Women's Hospital together, we provide this training on family violence, and we've provided over 450 instances of free legal advice to patients at the Women's. And that's a little cartoon that was developed by a doctor who does this work in the US, and I thought it illustrated what health justice partnerships are trying to do quite well. And then just the final slide. There was an evaluation conducted of this project a couple of years ago by a team at Melbourne University, including Professor Hegarty, who's here today. And just some of the findings of the partnership are that 7 of the 8 women who attended believed that receiving legal advice had a positive impact upon their psychological and emotional health. And you could see from that client in the film that it had had an impact on her. In terms of the training, we also saw a significant improvement in self-reported confidence, in having sufficient knowledge and skills to respond to women experiencing family violence. All of the 67 health professionals who responded to this evaluation survey felt they were able to help or knew what to do after attending this training. And there was a significant increase in their understanding of what a lawyer was doing in the hospital as well as an increase in the referrals to the legal service. So I just wanted to give an overview about our partnership, and that's it in a nutshell. But if we go to the next slide, I don't have the clicker. Yep, that's my details. We do respond to a lot of calls from people who are setting up these partnerships and are having teething issues. And if you've got questions or wanting to set up a partnership like this, please don't hesitate to get in touch with me. Thanks.